Scenario: an elderly man who cannot urinate. Introduce yourself and take permission. Hello, I'm Dr. Adam, one of the surgical doctors working here. May I confirm your name and age, please? Hi, doctor. My name is Jack. I'm 72 years old. Nice to meet you, Mr. Jack. I want to ask you a few questions about your condition. Are you okay with that? Yes, doctor. I'm okay with answering your questions. How can I help you? I have difficulty to pass urine. Analyze the main complaint. I'm really sorry to hear that. Could you tell me more about it? It started gradually a few months ago, and it's been bothering me ever since. I see. When did you first notice this difficulty and how severe it has been? I first noticed it a few months back, and it has been quite bothersome. Sometimes it gets worse, and other times it eases up a bit. Thank you for sharing that information. Is there any factors that may worsen or relieve your urination issues? I've noticed that drinking plenty of water can sometimes make it easier for me to pass urine. However, holding in my urine for too long tends to worsen the difficulty. Do you have any pain or discomfort now? Yes. Analyze the pain using Socrates. Can you point to the site of the pain, Mr. Jack, please? Yes, it's here on my lower belly. When did you start notice this pain? It started a couple of months ago with the wee problems. Can you describe the character of this pain? Is it sharp, burning, or cramping? It's a cramping pain. Does it move anywhere? No. Anything makes this pain worse or better. When my bladder is full, I will be in pain, and vice versa. I see. Does the pain come and go, or is it constant? It comes and goes, but I've noticed it getting worse in the evenings. That's helpful information. Thank you for sharing that. On a scale of 1 to 10, with 10 being the worst pain imaginable, how would you rate this pain? I'd say it's around a 5 or 6 most of the time. Differential diagnosis: 1. Benign prostatic hyperplasia. Are you able to hold your urine? No. Do you go to the loo more than usual? Yes, doctor. For instance, how often do you get up at night to pass urine? I find myself waking up several times during the night to use the bathroom. When you go to the loo, do you take long time to start urination? Yes, doctor. Do you take long time to empty your bladder? Yes. I see. Mr. Jack, did you notice any dribbling? Yes. 2. Prostatic cancer. Thank you for sharing that. Now, have you noticed any unintentional weight loss? No. Have you seen blood in your urine? No, there's no blood in my urine. I see. Have you experienced pain in your back? No, I haven't experienced any pain in my back. 3. Urinary tract infection. Mr. Jack, have you been unwell recently, or have you experienced any fever or chills? No, I haven't been sick recently, and no fever or chills. Did you experience any burning sensation during micturition? No. Good to know. 4. Neurological disorders. Have you noticed any numbness or weakness in your legs? No, my legs feel fine. Past medical and surgical history. Were you diagnosed by any medical condition? Yes, doctor. I have diabetes and hypertension. What medications are you taking? Metformin and amlodipine. I think, Mr. Jack, have you had history of hospitalization? No. Have you had history of surgery or catheterization? No. Mr. Jack, do you have any allergies? No, I don't. Social history. Mr. Jack, I would like to ask you personal questions. Is that okay? No problem at all. Go ahead, doctor. Can you tell me about your occupation and if there's anyone at home with you? I work as an office manager, and my wife is at home with me. All right. Thank you for that information. Do you have any difficulty with stairs or any other physical activities? No. I can manage stairs without any difficulty. That's good to know. Mr. Jack, do you smoke? And if so, how many packs per day? Yes, I smoke about half a pack per day for 20 years now. Do you consume alcohol? And if so, how many units per week? Yes, I drink alcohol occasionally, about 5 to 10 units per week. Family history. Is there anyone in your family experienced similar symptoms? No one I'm aware of. Idea, concerns and expectations, ICE. Mr. Jack, what do you think the cause of your symptoms? I have no idea. Is there any concerns you have about your condition? Well, I'm concerned about managing this condition and finding out what's causing it. I understand your concern. Systemic review, start from head to toe to make it easy. Do you have a headache? No. Have you experienced any palpitations, chest pain, or shortness of breath recently? No, doctor. Have you had any cough, difficulty breathing, or wheezing? No, I haven't. Are you experiencing any stomach pain? No, thanks, Jack, that's all. I will discuss with my senior and get back to you. Do you have any question? No, doctor. Thank you. Discussion. Present your patient. I took a clinical history from Mr. Jack, a 72-years-old male, describes a gradual onset of urination difficulties over the past few months, with aggravation when holding urine and alleviation upon voiding. He reports experiencing cramping lower abdominal pain, mainly in the late afternoon and evenings, which he rates around 5 to 6 on a pain scale. He mentions frequent nocturnal urination and the need for effort to initiate the urinary stream, along with post-void dribbling. There are no significant weight loss or back pain. No blood in the urine, fever, or chills are reported. He is a smoker and occasionally drinks. What are your differential? Benign, prostatic, hyperplasia, urinary tract infection, UTI, prostatic cancer, bladder cancer, neurological disorders.
How will you investigate your patient?
Clinical assessment, digital rectal examination, DRE, to assess prostate. Investigations, so I will request urinalysis to exclude urinary tract infections and to check for microscopic hematuria, prostate-specific antigen, PSA, inflammatory markers, imaging like transrectal ultrasound to visualize prostate size and structure, cystoscopy to directly inspect prostate and bladder, post-void residual measurement to assess urine retention. What is causes of increase, PSA, BPH, prostate cancer, UTI after ejaculation, instrumentation. How will you treat your patient? Lifestyle modifications, avoiding alcohol and caffeine, especially in the evening. Stop smoking, limiting fluid intake before bedtime. Medications, alpha blockers, relax muscles around the prostate and bladder neck. For example, doxazosin, terazosin, and tamsulosin. 5. Alpha reductase inhibitors, example, finasteride. Reduce the size of the prostate gland. Surgical procedures, transurethral, resection of the prostate. Which a blocker has antihypertensive property? Doxazosin, terazosin.
Thank you, doctor. You can proceed to the next station.